They were
Well,
both
talking about the aging-related
what?
diseases, I'm wondering that more than 1,000 of your patients have been treated with rapamycin, and how many of them reported significant improvements?
Uh, Generally, most everybody seems to be doing real well
Everybody.
because everybody sort of like wants to get like continue with their treatment. If like people weren't doing well, they would like say, "Oh, I don't notice any improvement." I'm like not going to sort of like continue. People generally sort of like are able to detect that they're doing better. They basically are able to detect that they're aging slower, that they have less aches and pains, that they have like more better mental sharpness, that they detect enough sort of like beneficial things that they continue with treatment. In other words, otherwise, in other words, if you just like took it and then said, "Oh, I didn't feel any different," or I was the same, people would stop right away. Nobody stops. The idea that people
Nobody
is
stop.
like want to continue is they're noticing like subtle change. They might be noticing big changes or little changes, but they're generally noticing things that they consider like beneficial. But
And
depending
except
on
for their reporting themselves feelings, based on what criteria or indicators can you make judgments that rapamycin is really effective?
uh,
Everybody.
it depends on sort of like how people are doing, and how the but depending on sort of like how people are doing, people sort of like generally notice that they're doing better. Like I mean, for one thing, people immediately notice that they don't have gingivitis. So as soon as they sort of like notice that, I mean, in other words, that's the first thing people generally notice. They no longer have gingivitis, right? Their gums don't bleed. Their gums have a much better, higher quality. So that's, in other words, they go to the dentist and none of that. That's like one thing they like notice. And people notice less aches and pains. And they notice generally this a better degree of mental sharpness. But people generally are like noticing, for the most part, people are very, very slow. They like, in other words, they don't have, they have very slow mental like deterioration of aging. But people sort of like notice this. Otherwise, people would continue with treatment. And like people sort of like generally can like tell that this sort of it like not there was this fairly like subtle, but they can tell that this are like doing better. Uh, but basically, it's true. It's much more effective with early sort of like changes. In other words, slowing down early changes. It's not a good treatment for end stage disease. It's a treatment of sort of like early sort of like things. In other words, but the early sort of like things involving aging, people definitely notice. In other words, they notice if they're like, and simply like feeling better. I mean, most of the people just take sort of like age-related changes for sort of like for granted. In other words, this sort of like slow deterioration people take for granted because
Then
everyone
what about their physical indicators? I mean, such as
physical,
that
physical
insulin or glucose? Do you make measurements about that?
uh, the only thing I tend to sort of the physical measure things to measure is I like to measure insulin sensitivity. Insulin sensitivity tends to improve. It's like if I measure
Uh,
insulin sensitivity, I measure insulin and glucose and multiply them together, and that gives you an insulin sensitivity score. So that tends to improve. But for the but the age-related changes, there's this it's just affecting a huge number of different organs. So all sorts of people are coming up with all sorts of different things that they notice. But lots of people will notice enough sort of like things to convince themselves that they're doing better. I'm going to take
and have you ever witnessed any side effects? Or
sorry.
if the rapamycin is not appropriate for some patients,
Side effects? Did you say that, like kind of like side effects? Is that what you said? Oh yeah, the number one side effects is people can have a slightly increased risk of getting a bacterial infection. That's the sort of like, in other words, because rapamycin is turning down the innate immune system. The innate immune system is driving all these age-related diseases, but but it's also the innate immune system is your first line of defense against bacterial infections. So people have a slightly increased risk of having a bacterial infection and a slightly increased risk that a bacterial infection would be a bad infection if you didn't take antibiotics. But I give everybody a prescription for azithromycin, an antibiotic to have on hand. Like half the people never like take it, but some people do have it, and so having an antibiotic on hand is very, very helpful. Generally, if you have an antibiotic, you're better off with where a bacterial infection goes. You're better off having azithromycin and also rapamycin than neither one. So like somebody who's taking rapamycin, that was the idea is that the rapamycin, if they took it on Sunday and you got sick on Monday with some sort of like cough, it'll take a whole week for it to like wear off. But if you take the antibiotic on sort of like Monday, by like Tuesday, you or remember that you already had anything. You'll be better within a couple of hours. So having an antibiotic on hand works very well. The other thing about antibiotics is the sooner you take them, the quicker they work.
Then facing with all these side effects, what should we do? How can we deal with that?
Say that again.
How could we do to treat or to deal with the side effects?
Oh, well, that's the only side effect. The only real side effect is a bacterial infection. If
Yes.
so, a bacterial infection is something that some people get once a year, some people never get. Some people, like, in other words, if anyone has a bacterial infection, they have to take azithromycin, they get better. That's the end of that. So it's not like, in other words, it's not much of an issue because people have antibiotics on hand. So
Then
for the first part, the side effects tend to, since that's the only real side effect, it's not much, the like side effects tend to be like very, 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 very small. People get more side effects from most of the other drugs. Like,
yeah,
I mean,
I agree on that.
somebody taking statins is much more likely to have a side effect of sort of like than someone taking rapamycin. I mean, a good 25% or a third of the patients can't take statins because they get muscle cramps. Almost nobody has like can't take rapamycin. So like rapamycin, the side effects rather infrequent compared to lots of other drugs. And
Yeah,
also,
I totally agree on that.
also no one seems to have allergic reactions. In other words, it doesn't seem to have off-target effects. In other words, it's not cytotoxic. It doesn't kill cells. So so basically, it's the sort of like aside from it's just the effect of decreasing the activity of the innate immune system is the main sort of like reason why people have a side effect. And that's just basically like this slightly increased risk that you could get a bacterial infection. On the other hand, there's much less risk of getting, say, a viral infection because it improves the resistance against viral infections. So on balance, it sort of like it seems to work pretty good.